Welcome back, our fans. 6. Maternal anxiety. There is significant correlation between maternal anxiety and a child's cooperative behavior at the first dental visit. Highly anxious parents tend to affect the child behavior negatively. 4. Parental attitude toward dentistry. Parents with positive dental attitude will develop the same in the child. The decision should be taken separate or leave the parent to accompany the child. If he/she wish to remain in dental office, they should instruct it and warn not to interfere in any way during conjunctive treatment. If you decide separation, consider the following. A. Explain your policy about their presence or absence in the operatory. B. Assure them about your interest and concern for their child. Advantage of separation. 1. Parent often repeats orders or creates annoyance. 2. Dentist unable to use voice control in the presence of parent, may be offended. 3. Child's attention is divided between dentist and parent. 4. Dentist attention is divided between child and parent. Disadvantage of separation. 1. Parent may assist in support and communication with the child. 2. Very young patient is very difficult to be reached without the parent. The interplay between main and cofactors could affect the child behavior in dental office. Classification of child behavior pattern. A. Frankel's rating scale. 1. Definitely negative, refuses treatment. 2. Negative, reluctant to accept treatment, negative attitude is not pronounced. 3. Positive, accepts treatment, complies but with reservation. 4. Definitely positive, interested, laughs and enjoys the situation. B. Wright's classification. 1. Cooperative child, relaxed minimal apprehension. 2. Lacking cooperative ability. Young child up to 2.5 years. Mentally handicapped. 3. Potentially uncooperative, has a behavioral problem that can be modified. This category includes 1. Timid, shy or bashful child hides behind his mother, looks down when addressed, rarely responds to questions or commands. Break his shyness, call by nickname, show interest in his hobbies, try to make conversation with him, show kindness. Can be reached through his mother. 2. Defiant or resistant child. Usually a stubborn, spoiled. Defies the dentist to do anything, refuses to open his mouth, and screams loudly without tears. Techniques of behavior management of difficult child. Voice control. Hand over mouth technique, HOME. Physical restraints. Voice control, tone is very effective in altering the behavior during communication. Use sudden firm commands to get the child's attention. Loud commands help reduce disruptive behavior. Hand over mouth technique, HOME. Aims, 1. Child knows that the dentist is the master of the situation. 2. The child learns that the dentist is not impressed by tantrums or defiance and work is going to be completed. Restrictions. Resistant child only. Hand over mouth only. Lasts for few seconds. Hands should be removed once child stop. Performed in the absence of parents. 3. Fearful child usually is apprehensive, pale, heart beats fast, quiet crying, may resist but usually obeys. To manage such a child you have to 1. Know the cause of his/her fears. 2. Overcome by demonstration and explanation, TSD. 3. First appointment should include only simple procedures. 4. Use firm but kind voice tone. 5. Do not use force to avoid psychological trauma. 6. Give the child a signal to use if he feels uncomfortable. 7. Use physical restraint only in case of emergency. Techniques of behavior management. Principles of behavior management technique. 1. Anticipation. Explain procedures and answering questions, TSD. 2. Diversion. Diverting the child's attention away from fear-producing situation, audio analgesia. 3. Substitution. Substituting unwanted behavior by an accepted behavior, modeling. 4. Restriction. Restricting a child from exhibiting unwanted behavior. Techniques of behavior management. Non-pharmacological methods. Apsychological for removing dental anxiety. 1. Pre-appointment behavior modification, aimed at preparing the child to dental visit. It include anything that is said or done to positively influence the child's behavior before the child enters a dental operatory. Types. A. Positive reappointment imagery. B. Direct observation. Audio-visual modeling. Live models. C. Pre-appointment mailing. 2. Behavior shaping, is the process of influencing behavior towards desired ideal. A. Tell, show, do, TSD, It is a series of successive approximation based on informing, then demonstrating, and finally performing part of a procedure. B. Positive reinforcement. Reinforce appropriate child's behavior through verbal approval or giving a gift at the end of visit. C. Desensitization. Steps taken to reduce the sensitivity of the patient to a particular anxiety-producing situation, object. Technique involves 3 stages. 1. Training the patient to relax. 2. Constructing a hierarchy of fear-producing stimuli related to the patient's principal fear. 3. Introducing each stimulus in the hierarchy in turn to the relaxed patient, starting with the stimulus that causes least fear, and progressing to the next only when the patient no longer fear that stimulus. D. Modeling. Let the child reproduce a behavior exhibited by a model. E. Distraction. Is the technique of diverting the patient's attention from what may be perceived as an unpleasant procedure. Thus it helps to decrease the perception of unpleasantness and avert negative or avoidance behavior. 3. Communication is the real key to behavior management. The hallmark of a successful dentist in managing child dental patient is his ability to communicate with them and win their confidence. It may be physical, visual, verbal. Physical, by patting the shoulder or striking the hair. Visual, appearing relaxed and friendly. Verbal, words must be used at the child's level of comprehension. B. Hand-over-mouth tech. HOM. C. Physical restraints, devices used to restrain body movement. Indications. Extremely resistant child. Physically handicapped child. Can be helpful when used with kindness. Used with mother's help. Used alone or with sedation. Types. 1. Body, papoose board and body wrap. 2. Extremities, stapes and safety belts. 3. Head, head stabilizer and head positioner. 4. Mouth, mouth props and mouth gags. Thanks for watching. Support us by likes and subscribes.